I'm Dr. Leonard Knell, an orthopedic surgeon who's been practicing in Canton, Ohio for 34 years, now retired. I've been retired for about the last 5 years. Over the years, I've always felt that massotherapy has been a very effective adjunctive therapy in the treatment of musculoskeletal problems. And I use it in my practice for my patients who had musculoskeletal problems when I felt it was indicated. A number of years ago, Mike Jones introduced me to the concept of neuromuscular therapy, which I had not been familiar with at that time. And I really feel that that has been an additional dimension in the treatment of musculoskeletal problems. I've always felt that many of the pain patterns that we see are not completely related to the joint per se, but are related to the soft tissues, muscular imbalances and so forth around the joint. Many patients that I would see in my office would come in to see me complaining, say, of knee pain, and after a workup I would find out that they really had nothing wrong with their knee, but they had muscular imbalance around the knee, and once you were able to establish normal muscular status around the joint, the pain went away. Same thing goes for pain in the soft tissues and ligaments around the knee. Once that can be correctly addressed, then the pain in the joint would disappear. Now, Mike has developed a system of treatment for many musculoskeletal problems, and especially he's really focusing on fibromyalgia. And to understand really the basis of his treatment, you have to understand what happens in the nervous system. With the nervous system, there's a constant communication between the central nervous system and the body. And by the central nervous system, I mean the brain and the spinal cord. And the rest of the body we'll call the peripheral system. That's the body, your arms and legs, etc. Now, one perceives a stimulus. The patient will perceive a stimulus at the level of the peripheral sensory receptor. And this signal travels through the afferent nerve to the spinal cord up to the hypothalamus and the thalamus. And then up to the cortex. It's perceived by the brain, and then there's a reaction from the brain that's sent back down through the cord to the area where the stimulus was perceived. And I'll give you an example. For instance, if I touched something that was hot, if I touched something that was hot, the impulse would move up my afferent nerve to my cord, up the cord to the brain, and then the brain would react to this and would send a signal back to my cord and stimulate my muscles to pull away from the hot substance. And in effect, this is the way it works. Now, let's say we had a stimulus that was very strong. That stimulus would spread through the internuncial pool, which is in the center of the brain, and would cause widespread dissemination. It causes much more of a reaction, and what would occur would be much more than just pulling away. I may start screaming and yelling around and running around like a chicken with my head cut off, because it's a much more widely disseminated signal. Our systems work on the basic principle of excitation and inhibition of the central nervous system. This is the central integrative state of the central nervous system, and it's dependent on afferent signals going to the brain. These are good signals that sort of balance the excitatory and inhibitory mechanisms of the brain. And the lack of these signals is called deafferentation. And it's Mike's hypothesis that deafferentation, the biggest cause of deafferentation, is caused by nerve compression, which occurs, he feels, mainly at the level of the neck, and also by a lack of mechanoreception. These are receptors that you would pick up distally. And it's this deafferentation that he feels is at the root of many musculoskeletal symptoms. Now, with Mike's method of neuromuscular therapy, he attempts to correct the cervical curve and at the same time increase the good afferent signals through increasing mechanoreception. He does this by decreasing soft tissue pain by using his neuromuscular therapy, deep muscular massage. In addition, he's developed what he calls the Jones hyperextension intersegmental technique for working on the cervical spine. And he also uses a postural pump for this to help restore the cervical curve. In addition, he'll use a number of neurological exercises to balance the central nervous system, which increases the afferent signals sent by the mechanical receptors. Now, Mike has postulated, and I agree with him, that fibromyalgia is caused by pain signals overwhelming the central nervous system, and that the proper afferent signals are not getting through to the brain. So you don't have this balance coming between this excitatory and inhibitory mechanism within the brain. And he feels that by restoring the proper curvature of the neck and by alleviating the nerve compression in the neck, he feels that more good afferent signals can get through to the brain, and in this way, when this occurs, other areas of the body will respond to treatment with his neuromuscular therapy, and the fibromyalgia will resolve. Now, over the years when I was in practice, I sent a number of patients to Mike who I felt had either right or left-sided compression, and he treated it with his means of treatment. And most of these patients had failed conservative treatment, either from physiotherapy, or many of them had prior chiropractic treatments, and they failed treatment. And I have to say that Mike, using his techniques, really was able to get most of these patients back to full functional level and off of all medications. And I was really quite impressed with his results. And then a number of years ago, Mike said that he was having really very good results in treating fibromyalgia and some chronic fatigue patients. And he asked me if I would review his patients to prove that there was complete resolution of symptoms, and I told him that I would. And I think to date, we have examined 25 patients that have had full resolution. Now, to be included in this study, patients had to have the diagnosis made by a physician, either a physiatrist or a rheumatologist, and they had all failed conventional treatment. And I would say that using his symptoms, or his treatment, the symptoms in these patients is completely resolved. Now, to sum it all up, all I have to say is that Mike is an excellent practitioner. I have the utmost respect for what he does, and I think that to sum it up, really one can say that the proof of a treatment is in what the response is, and I have to tell you that if the treatment works, then the treatment is good. And from what I've observed, Mike's treatment does work.